And good morning, everyone. This is Dr. Sonia McGowan here with our monthly webinar. We're so glad you're here. So today we are talking about how we help complex kids here at Covenant Wellness. And we're going to specifically be talking about functional nutrition and how we test, target, and transform kids' health. So just a little bit about me. I'm the owner of Covenant Pediatrics and Covenant Wellness Center. And I live in Jefferson City, Missouri with my husband, Shannon, who you see there on the left. He is a fairly newly retired CPA. So he's figuring out life without, work, which is great for me. We have two kiddos. This is Libby. She is 22. She lives in Kansas City. She's a musician. We also have Rowan, who is 20. He goes to college in Illinois. He is a theater costume design major. And we also have Ozzy. He is our 2-year-old sheepadoodle who sort of took the place of the kids when they left the nest. So this picture of Rowan, I always include because when he was a little guy, he struggled. We had a very difficult time finding help for him. He had a lot of eczema. He had a lot of poop issues. He was very late in most of his milestones. He had a lot of behaviors, and it was very, very difficult finding doctors to help us and finding doctors who didn't say stupid things like, oh, he's not talking at age 4 because he has an older sister, or, telling me that I was a helicopter mom because he couldn't hold a pencil when he was 4 years old. Right. So we went through a lot, and we went through most of it when I was in chiropractic college. So I had worked with kids with autism for many, many years previous to this. And I had gone to a conference in 2001 that really opened my eyes to the fact that autism isn't genetic. It is not purely behavioral, right? There are environmental factors. There are medical, biomedical factors that promote autism. And thank God I knew that, because what I learned about my son is that he had a very significant yeast overgrowth in his intestine that was really driving so many of his delays and his physical issues. And so as I was in chiropractic college, my original goal was to work with kids on the spectrum, but Rowan sort of changed my perspective that there are more than just kids with autism there. And so from there, I coined complex kids, and we're going to talk a lot about that today. So I consider him my first recovery story. He's completely neurotypical. He's in college, no accommodations, on the dean's list, fully verbal, doing great. He's an absolutely amazing human being. So, all right. So at Covenant, some things that we do, we really strive to be a one-stop shop for parents who have kids with complex needs. So in our complex kids program, we do functional nutrition, we do chiropractic, we also have hyperbaric oxygen, we have ion cleanse, foot baths. We do a lot of work with babies, toddlers, and even older kids around oral restrictions. So tongue ties, lip ties, cheek ties, etc. We have 2 other chiropractors on staff, and they are qualified to work with kids and expectant moms. So we do a lot of work with those types of patients. And then we also see adults too. So adults for chiropractic, but also adults for things like HBOT, nutrition testing, food allergy testing, acupuncture. So it's, even though our name says kids, we also do see adults. And then, of course, we have a separate practice, Covenant Pediatrics, where we have Dr. Hannah Strong, who is a pediatrician. And so she is fully booked, busy all the time. We're in high demand because we respect parent choices around vaccines. So if parents want them, they can get them. If they don't have to. And they don't have to worry about being dismissed from the practice if they choose not to. So when I say complex kids, what do I mean? Well, the obvious things like autism, like PANS and PANDAS, like ADD, ADHD, and other things like oppositional defiant disorder, reactive attachment disorder, things like that. But also things like oral restrictions, so TOTS, tethered oral tissues. Maybe kids who have some retained primitive reflexes. And so maybe that's causing issues just sitting still in their desk at school. Maybe they have constipation. Maybe they are very selective eaters, right? Any sort of behavior, language, socialization challenge. And then what I call square peg, round hole kids. So these are kids who maybe don't have a diagnosis. There's nothing really screaming in terms of, really, really difficult symptoms, but maybe, they only poop once or twice a week, or maybe they struggle to go to sleep every single night. Maybe they wake up at 3 a.m. ready for the day every day. Maybe they have eczema, right? So little things that aren't so little are also the kinds of kids that we're really good at working with. So what we say here all the time, there are no bad kids and there are no purposeless behaviors. So the minute a kid walks in the door, we're looking at them, we're watching and observing, because it tells us a lot. The way they walk, the way they sit, the way they interact with toys, the way they interact with their family, or the way they interact with other kids in the office. It tells us a lot, because there are no purposeless behaviors. Everything is for a reason. So today, talking about our functional nutrition blueprint, who is this for? It's really for everybody, but particularly parents of complex kids, parents who maybe are starting to think, my kid might need some support. It's also for parents who have literally tried everything. They've been everywhere. They've done everything. It's also for parents who've been told that their doctor won't do labs on their kids, or they were given some labs and told they were normal. We see that a lot. And it's also for professionals too, who are eager to work with kids who are complex and just kind of need to know how we do that. So families come to us for a lot of different reasons. Generally, it's persistent, troubling symptoms. So it might be self-injury, it might be aggression, it might be moodiness, it might be constipation, it might be diarrhea, it might be sleeplessness, etc. Right? Nothing is too small for us. So persistent, troubling symptoms that are starting to really get in the way of everyday life. Or it's kids who come to us whose doctors say their labs are normal, but yet they're not progressing. They're not getting answers. Nothing is changing. A lot of times, kids will be somewhat stable. Parents have it under control until they don't. Things start escalating. Things change overnight for a lot of kids. They'll go from, doing fairly well to all of a sudden, they're not okay. A lot of families experience what I call fragmented care. So they just aren't getting consistent, good guidance and care and labs and assistance with their kids. And I wish I could tell you I never heard this, but I hear so many families tell me that other doctors have said chronic constipation is just autism, or not sleeping is just autism, or self-injury, aggression, you name it, fill in the blank, is just autism. That's absolute nonsense. Nothing is just autism, right? There is a reason for everything. So a parent's effort is never the problem, right? It's not that they're just hanging out, enjoying self-injury and aggression and constipation. They're looking for help, but there just aren't enough doctors out there who care to understand complex kids. So again, the problem isn't a lack of trying. Most parents have sought lots of different providers of different kinds. I know I did. I went to pediatricians, I went to chiropractors, I went to naturopaths, I went to OTs, I went to physical therapists, I went to speech therapists, and I was told a wide variety of things, a lot of stupid things. I even had one occupational therapist tell me if my son really wanted to tie his shoes, he would. If he really wanted to be able to go down a slide, he would. If he really wanted to swing on a swing set, he would. Yeah, it was all nonsense. It still makes me mad, almost 20 years later. So lots of providers. Some families have done lots of tests, so they have found providers who will actually order the right tests, like an organic acids test, a comprehensive stool analysis, etc. But what ends up happening is while the doctor is willing to order those tests, they don't know how to analyze the tests and give an intervention plan based on the results. So I've had many, many families come to me with a stack of really good tests, but that provider has just handed it to them and said, "Good luck. There's your test results," right? With no real guidance or continuity of care for that. A lot of families come to me and they've already tried many, many supplements. Sometimes they've just tried to figure it out on their own. Sometimes they've gone to a provider who is maybe not super experienced in this yet, and they want to give a pill for every ill, right? Supplement or pharmaceutical. And we just can't do that. We can't give a kid, 20 different supplements in a day. It's not feasible. It's not sustainable. And so, again, these are parents who have really tried. They've done lots of things. They're not making much progress, or they're told, again, nothing is wrong. It's just autism, blah, blah, blah. All right. So symptoms are not random. The body communicates through patterns, and that is why we often will see behaviors as a downstream effect of these symptoms. I know if I only poop twice a week, I would not have very good behavior, right? Neither would you. So symptoms follow systems. And so one of the things that we're very good at here is taking a very detailed history. We look at physical signs, we look at behavioral signs. And then we take all of that and we try to organize symptoms. So the primary things that I'm looking at when I'm assessing a child is digestion, sleep, and behaviors. So in my head, throughout this whole exam process, I'm thinking, eat, sleep, poop. How do they do that? How do they eat? How do they sleep? How do they poop? And then what do their behaviors look like? So let's start with the whole digestion situation. So eating, pooping, how do they do that? So these are some of the patterns that we see in complex kids. So we will see kids who are very selective eaters. So sometimes it's based around texture. They will only eat crunchy things, or they will only eat soft things. Sometimes it is based around color. I will not eat anything green, or I will only eat things that are white, right? Sometimes it is based on temperature. Sometimes it's based on spiciness, right? It really just depends on that child, but they have definite patterns there. A lot of times we'll also see kids who have cravings. So they will drink a gallon of milk in a day if mom would let them. They would eat a loaf of bread in a day if mom would let them. Sometimes they crave other things like carbs, for example, is a super common one. Kids only want things that are carby, right? Many times we will see kids who have belly pain. Sometimes they can't tell us, but there are definite signs for that. And I will always ask parents, do you suspect that your child has belly pain? And parents know, right? If you've got kids, you know. So belly pain is very common. So is acid reflux. And so whenever I see a kid who drools a lot, that can mean something like oral restrictions, but drooling is also a strong sign of reflux. We also see a lot of kids who graze instead of eating full meals. So they just sort of eat a little bit all the time rather than sitting down and eating a distinct meal. And grazing is a very strong sign that a child is having belly pain. So again, with texture issues, a lot of kids can't handle certain textures and just won't tolerate those kinds of foods. We see kids who have lots of poop issues. So sometimes they have constipation. Sometimes they have diarrhea. Sometimes they have both at the same time. So alternating constipation diarrhea is a very common situation. So what ends up happening, the child has some constipation and then they have what we call breakthrough diarrhea around that. So it's very, very common for complex kids to have constipation diarrhea or both. And just sort of weird poops in general, odd smell, odd texture, odd colors. Sometimes we'll see, very frequently actually, undigested food in the stool. So just kind of, if there was a category called weird poops, our kids would fall under there most of the time. We see a lot of gas and bloating. We also see posturing. So I've got a picture in the next slide for you, but kids they'll take postures that put pressure against their bellies. So they will lay on the floor with their rump in the air. They'll lay across the couch arm. They'll take parents' hands and push their hands against the abdomen. Those are all very strong signs that there's something digestive going on, that they're probably having some pain. And then skin issues. Whatever happens on the skin is a reflection of the gut. So kids who have chicken skin or the keratosis pilaris bumps, kids who have eczema, kids who have rashes, hives, things like that, that's always tied to digestion. So this is a picture of kids who are posturing. Now, these are two different kids. They don't know each other. Their families are from far away from each other. But look what we see, right? It's the very same posture for both of these kids, both on the spectrum, both with pretty severe digestive complaints. All right, so when I see a lot of digestive symptoms, what am I looking at? What am I thinking? Like when I'm with a family and a child, my mind is going all the time. I'm watching everything they're doing. I'm doing their physical exam. I'm taking the history and I'm thinking, how does this relate to this? How does this symptom relate to what we need to look for or test for? And so when I see a lot of digestive symptoms, I'm immediately thinking we have to figure out if a child has nutrient deficiencies. The vast majority of them, like 99% of kids I test, have some level of nutrient deficiencies despite being fed well, right? I never suggest that a family isn't feeding their kid, but there are lots of factors that go into how a child uptakes their nutrients. So I always want to look at, do they have deficiencies? Often, these are kids they're just not good digesters in general, and that often starts with low stomach acid and low digestive enzymes in general. So we have enzymes in our saliva, we've got enzymes in our stomach, we have enzymes that come from our pancreas, and these are kids who generally are just weak digesters. So not enough enzymes, not enough stomach acid. And many times, one of the tests that I do gives us a look at malabsorption, and many kids have malabsorption of the intestine. And often this is caused by what we call dysbiosis. So dysbiosis is an imbalance of the beneficial and not so beneficial flora in the intestine. And so it's very common for us to see things like a yeast overgrowth, a bacterial overgrowth, and a wide variety of different types of bacteria. Generally, we see in these kids a lot of inflammation specific to their intestine, but also systemically. And that inflammation interferes with the way they can absorb their nutrients. We also see a lot of food allergies and food sensitivities. I have done a couple of webinars in the past about food allergies, food sensitivities, and how those differ. So go and look those up, and I'll tell you at the end where to look for those things. And then oral restrictions. So if a child has a tongue tie or lip tie or even a cheek tie, it greatly impacts their ability to manage the food in their mouth. Digestion starts in the mouth, right? And so if they can't manage that food, if they can't chew it up appropriately, if they can't have enough saliva, if that saliva doesn't have enough enzymes, if they can't, put that food into a ball or a bolus and then swallow it, there will be downstream effects to that. So often we see kids who have oral restrictions who have a lot of digestive issues. So They often develop food allergies and sensitivities because of this. They often have digestive challenges like constipation or diarrhea. So, oral restrictions are a big deal for a lot of reasons, but digestion is a big one. All right, so eat, sleep, and poop. Now we're at the sleep section of this. So, generally, complex kids aren't good sleepers. If I ask a parent, how do they sleep? And they're like, oh, they're such good sleepers. I almost always say, oh, praise God, because everything is so much harder when your kid doesn't sleep. I remember my kid never slept. We had about a year of never sleeping more than about an hour at a time. And then he'd be up for 2, 3, 5, 8 hours. And then we'd sleep an hour and we'd do it all again around the clock. And when you're exhausted and you're sleep deprived as a parent, your bandwidth is low, your patience is low, and it's tough. It's one of the hardest situations that parents face. So here are some of the patterns that I see in terms of sleep for complex kids. One of the things that I hear parents tell me a lot is that as bedtime approaches, instead of winding down to go to sleep, these are kids who wind up. So they become hyper, they become anxious at bedtime, which then, is a whole thing, right? You're ready to go to sleep as parent, and kid is now bouncing off the walls. So that's, again, very difficult. These are kids who have trouble falling asleep. They have trouble staying asleep. So they might, wake up multiple times in the night. They might wake up early, super early, and be ready for the day. These are also kids who have a lot of snoring and mouth breathing. So snoring in a child isn't cute. It is a sign of oxygen deprivation, right? They should not breathe through their mouth at all. They should only be breathing through their nose. And so kids who snore and breathe through their mouth often have very restless sleep too. These are very strong signs of sleep disordered breathing and are often related to oral restrictions, tongue ties, lip ties. So if your child is restless, they snore, they breathe with their mouth open, you definitely need to have that assessed. Again, with the early waking unrested, taking forever to fall asleep, and then they finally get to sleep, and then it's time to get up, and it takes a long time for them to get moving in the morning. A lot of parents will tell me that their child will wake up in the night and laugh and chatter to themselves. Very common. These are kids who often can't sleep alone, and they will often have nightmares or parasomnias. So nightmares, night terrors, but maybe also walking in their sleep, talking in their sleep, things like that. And so when I look at the systems around this, like what patterns am I putting together? Again, airway issues, oral restrictions are big. When kids wake in the night, giggling, laughing, talking to themselves, it almost always means something's going on in their gut. And generally, it's yeast. Often it's parasites. Often it's bacteria. I know my son Rowan was that way. He would wake up and just giggle hysterically at nothing. And as we did additional testing, we found he had terrible yeast overgrowth, as I mentioned. So sleep is often related, poor sleep is often related to an iron deficiency. So that's one of the tests I do pretty much with every complex kid who comes in. It is exceedingly common for us to see a very low ferritin, which is the storage form of iron for kids who are complex. It's also really common for us to see blood glucose instability. So these are kids whose blood sugar crashes pretty consistently. And so it makes it harder too, because often they're selective eaters, right? They're not great at eating good solid meals. They want to graze all day. Maybe they only want carbs, right? And so it's hard to stabilize blood glucose with an eating situation like that. Often it can be related to immune activation. So kids with, a hidden infection like strep or Epstein-Barr or mycoplasma tend to experience sleep disruption. And then nervous system dysregulation. So these are kids who are stuck in fight or flight, right? They're generally kids who don't rest and digest very well. They're not great sleepers, not great eaters, not great poopers. So what that immediately tells me is they're stuck in fight or flight. Their nervous systems are dysregulated. And so one of the things we very consistently recommend for complex kids is pediatric chiropractic adjustments. When you see a pediatric chiropractor, at least for us, we are very focused on the nervous system versus moving a bone, pressure on nerves, kind of the stereotypic chiropractic approach. And so it's very common for us to work with them on a functional nutrition side, but also refer them to chiropractic, because getting a chiropractic adjustment is one of the best ways to help your body transition appropriately from rest and digest to fight or flight and back again. All right, so eat, sleep, poop. We've talked about that. Now let's talk about behavior. So kids who are complex have lots of behaviors, a wide variety, right? No one is exactly the same, but here are some of the common things that I see. So anxiety, especially at bedtime, right? We talked about that, but anxiety around things that just they shouldn't be anxious about, right? Irritability, a lot of self-injurious behavior, maybe aggression. We will also see for some kids some very extreme mood swings. They're fine until they're not, and then they hulk out, right? They're fine, and then they just lose it. We see a lot of tantrums. We see a lot of sensory overwhelm, sensory issues, seeking, avoiding. It's very common for us to see kids who are very rigid. They want things a certain way. They have a lot of trouble transitioning from one thing to another. We see odd play skills. We see a lot of socialization challenges. We see regression in a lot of kids too. So sometimes the regression is after something medical, like a sedation from anesthesia. Sometimes it's a regression after they get shots. Sometimes it's a regression when they have a loose tooth or a new tooth comes in. Sometimes it's a regression after an illness. And so the regression might be academic, it might be developmental, social, behavioral, but it's very common for us to see kids who had skills and then lost them. And then we also see kids who experience a lot of urinary changes. So maybe they're completely potty trained and then they start wetting the bed or wetting their pants. Maybe they're completely potty trained and aren't necessarily having accidents, but they're having more urinary frequency, urgency, an increased volume of urine. They'll just out of nowhere, just you'll be at the store and suddenly they urinate without warning. So these are definite, very strong signals that we need to dig deeper for these kids. And so when the eat, sleep, poop, and behavior overlap, we're looking at patterns more than just single symptoms. And this is what guides me to figure out what are our testing priorities. We always test. We don't want to guess about what's going on. I don't want to waste time. I don't want to waste resources. And by resources, I mean, parents' emotional bandwidth. I mean time. I mean money, right? So we want to get right to it. We're not about fiddling around. Okay. So we test, we don't guess. And so we have lots of test options available. At my next month's webinar, I'm planning to talk more about what those tests are, but there are webinars from the past where I go in depth on the specific tests that I frequently do. So the organic acids test, stool test, things like that. So we have many test options. What we choose depends on their symptoms and the patterns of those symptoms. So we have lots of options. Again, we have urine test, stool. We have blood spot, which is a finger prick. We draw blood. Some tests allow us to do saliva or hair samples. So we have a wide variety because not every kid can tolerate everything, right? And sometimes it can be getting blood can be really difficult. Sometimes getting urine from a little one can be really difficult too. So we have lots of workarounds. We have lots of options. And so the testing gives us data. So I'm really looking at a sort of a finite list of issues, because I've worked with thousands of kids on the spectrum. I've done this my whole career. So I know what I generally find in kids. So I'm looking at nutrient deficiencies. You have to have a certain, those certain nutrients at appropriate levels so that the whole biochemistry can work. And so if we have deficiencies, we've got to correct those first. We're also looking for mitochondrial function. Again, I've done webinars on this too. So mitochondrial function is absolutely critical. It's a cornerstone of what has gone wrong for most kids who are complex. I'm looking for what's going on in the gut. Do they have malabsorption? Do they have dysbiosis? Do they have neurotransmitter um, dysregulation? Are they urinating out all their amino acids? Right? So we're looking at a wide variety of things to try to figure out, how do we get this child better? Our testing is intentional. It is not excessive. I am never going to work outside the bounds of what a family can afford or what they're willing to do. I generally will say, here are the things I would recommend. How do you feel about that? Which of those things make sense to you, are within your budget, etc.? So it's very intentional. I don't overdo it when it comes to testing. So interpretation is critical. And I find that this is generally the missing piece for most providers. It's easy to order a test. It's not so easy to look at the context and then know how to turn those findings into priorities of intervention and then an actual plan step by step. So the labs require context. You've got to, look at the big picture of that child. You've got to figure out what is the right intervention at the right time in the right order. And this is where we're different. We're very, very good at doing this part. So the key takeaways from today, I want you to remember: no bad kids, no purposeless behaviors, right? There's always something behind it. We must find the root cause, and nothing is just autism. So if you go to a provider and they use that phrase with you, turn around and find another provider, because that is absolute nonsense. Symptoms aren't random. The pattern of those symptoms matter, and you have to have good interpretation of those tests. You don't want to be handed test results and say, good luck, right? I remember that happened to me. I had a doctor who I respected very much, did the metabolomics from Genova, which is a test I now do very, very commonly. This doctor said, here, you can probably interpret this better than I can. And I paid for that visit, right? So you have to have good interpretation. You have to turn those results into something actionable. Kids deserve an appropriate exam and appropriate testing. If you go to a doctor who does not touch your child, go to another doctor. You cannot do a physical exam on a kid without touching them. And I wish this weren't true, but I have had so many parents tell me, you're the first doctor who's ever touched my child. I will tell you, there are some kids who are very severely affected, and some of their behaviors can be maybe overwhelming to some doctors. But you got to try, right? You have to listen to their heart. You have to listen to their lungs. You have to look in their ears, in their mouth. You have to listen to their bowel sounds, right? You got to check their reflexes. You got to do all of that to really get a good sense of what is going on with this kid. And another key takeaway: it shouldn't be so hard to get help for your kid. I have been shouting this from the mountaintops for 20 years, that it shouldn't be this hard. It was hard for me 20 years ago. It shouldn't still be this hard to get help for your kid all these years later. So, next steps. If you're concerned about your child, we can help you. We have lots of nutrition testing options. We have lots of intestinal health testing options. And we're different because we are highly experienced. I've literally been doing this my whole career. I have loved kids with autism since I was in college. And I see kids get better every day. We will examine your child. We will listen to your history of your child. We will listen to your concerns. We will never tell you it's just autism or fill in the blank. We are very, very good at ordering the right tests and knowing how to analyze those results and then how to turn that into a plan that makes sense, that's manageable, that's affordable, and that will bring progress for your child. I can't guarantee recovery. I expect recovery of every kid, but what I can generally assure parents of is we will make some progress. So, some things for you to think about doing now. Go to my website, covenantwellness.net. There is a printable that you can download that talks about our functional nutrition blueprint. Every month I do a webinar. I think in 2026 I'm doing 10 out of the 12 months, something like that. So in February, on February 6th, the webinar is called Eat, Sleep, Poop, What Your Child's Behavior is Telling You. I'm skipping March, and then in April, I'm doing a webinar, April 3rd, on low cholesterol, which is a really big deal for our kids. And then we have other resources that you can access anytime. So if you go to thewhymatters.net, that's a sister website of mine, and it houses all of my previous webinars. It also holds all of the blogs that I have written over the last few years. And so you're going to find information on things like mitochondrial dysfunction, how nutrient deficiencies affect behavior, oxidative stress, mold, pandas, etc. So lots and lots of good information there. And then we also have a YouTube channel. So if you go to YouTube and then put in at Covenant Wellness, you'll find us. And I have many webinars that are housed there as well. So lots of good resources for you, so you can sort of dig in and get this figured out, because nobody knows your child better than you do. And you have to advocate for them. It's not always easy, but it'll be worth it, right? So learn as much as you can. All of this information is free. You're more than welcome to, watch a webinar as many times as you want, right? And so definitely join me in February and again in April. And then, if you're concerned, call us, right? We're always taking new patients. If you specifically know that you want to schedule, the best way to do that is to email Brittany at covenantwellness.net. And I'm putting that in the comments section now. So to schedule, Brittany at covenantwellness.net, and she will be thrilled to help you. So there is a Q&A section on the sidebar. If you have any questions, I'm happy to answer them. But that's a little overview of how we kind of start our work with kids who are complex. So I hope you learned a little bit. I hope that it opened your eyes to some of the resources that we have available. So that's the deal. So thank you so much for coming. I hope you enjoyed it. I hope you learned a little bit. And we will see you in February for our next webinar on February 6th. All right, guys. I hope you have a great weekend. And as always, if you ever have any questions at all, you can email Brittany at the address that I put in the comments, but you can also email me, Dr. Sonia at covenantwellness.net as well. All right.